right, can I have everyone's attention, please? Thanks, guys. So thanks, everyone, for coming. I also want to, afterwards, there's coffee and snacks in the back, which you're all welcome to. But on behalf of Bentley's Health Thought Leadership Network, I'm really delighted to introduce our 2018 visiting scholar, Dr. Mohan Tanniru. And I'm going to read a little bit from Dr. Tanniru's very impressive resume, CV. He is the Professor of Management Information Systems in the Decision and Information Science Department of the School of Business Administration at Oakland University in Rochester, Michigan, and a Senior Investigator at Henry Ford Health System. Dr. Tanniru has taught at University of Arizona, Syracuse, University of Wisconsin-Madison, and he's the former Dean of the School of Business and the founding director of the Applied Technology and Business program at Oakland University, and the Department Head of Management Information Systems at University of Arizona. Dr. Tanniru has published extensively in information technology research over the past 30 years in areas such as IT strategy, knowledge-based expert systems, decision support and business analytics, and healthcare delivery management. His work has appeared in journals such as ISR, MIS Quarterly, Decision Sciences, DSS, JMIS, IEEE, Transactions in English, and Engineering Management, Expert Systems and Applications, Information and Management, and Communications of ACM. So lots of acronyms there, very impressive acronyms. And in addition to kind of his research work, he's coordinated numerous graduate and undergraduate projects with over 60 large companies, especially in the Detroit area, the car companies, GM, Chrysler, EDS, and Hewlett-Packard, Lear, Comerica, Carrier, Monty, Bristol-Myers Squibb, Honeywell, Intel, Raytheon, and several healthcare organizations such as Kaiser, Beaumont Health Systems, and St. Joseph's Mercy in Oakland, among others. So I have to say that when we scheduled this presentation for the end of February, our biggest concern was that there'd be a snow delay or a snow issue and that Dr. Tanniru would not be able to get here. I did not expect to have to, see everybody in shorts and t-shirts and wanting to, enjoy a 70-plus degree day. But I know that Dr. Tanniru will have some really insightful things to say about digital leadership in healthcare, how we can enable leadership to support the amazing transformation that's going on in healthcare right now. So without further ado, I want to welcome Dr. Tanniru. Thank you so much for coming to Bentley and for your time.
Thank you. You got to help me with the
Oh, yes, I'm sorry. I totally forgot. Go ahead. Here we go. Let's try this. And this should work. Yep, there you go. You're all set.
Good afternoon. Thanks for welcoming me to great weather in Boston, which is not something I was expecting. I have a set of slides that I'm going to go through, and I will keep it fairly quick, but since I have about 30 minutes, I'll try to cover most of the material and hopefully towards the end open up for questions. A friend of mine by name Ken Smith once told me that if I'm going to give a talk for 30 minutes, I better have a good story. And I guess, I don't know whether I'll have one good story, but I'll try to tell a few small stories. Hopefully all will kind of connect towards the end of what I want to say. Last year, a friend of mine, Josh from Arizona, called me and said, Mohan, you are doing some work in healthcare or in general business transformation, teaching a course in this area. Could you kind of come and talk to our friends on what this whole transformation is about? And I asked him when. He said December. And I said, coming from Michigan, going to give a talk in December in Phoenix is obviously very attractive. So I said, sure. So I went, but in the process of going and preparing for the presentation, I was kind of trying to compile some of my thoughts on business transformation in general. This I will go through very quickly because I know you all want to know more about the healthcare, but I think it's important to understand what transformation is happening in the business before we adapt or apply some of those things to the healthcare. Since the 21st century, when internet and web became prominent, and of course we all know the technologies like social media and others that came up after, consumers have become much more aware of what's out there that they want to purchase. And of course, they want to buy them online, and of course have that distributed to their home. So this significantly transformed the way companies market their product, distribute the product, and of course sell. Then when too much information became available on the web, consumers got confused as to what products do I buy, what airline do I take. And so suddenly Travelocities and Pricelines all came into picture and said, look, we'll do the aggregation, we'll provide you define the criteria, and we'll provide some choices you can make. So to some degree, suddenly consumer decision process became an opportunity to empower me as a consumer to define the criteria and how companies like intermediaries actually provide me the choices which I can make. And of course, with communication became easier. Of course, all of us as consumers started providing comments on the customer experience, the service that somebody provides after we buy the product. So there's a whole lot of evolution and transformation that has taken place in the way companies started changing their operations so that they can empower me with more information, with better information, structure some of the knowledge so I can do the taxes, I can do investments, I can do accounting, a lot of things on my own. And of course, I can engage with the product after I purchase. And now with the Internet of Things and AI, suddenly changing the way companies even, product companies even, start designing the products and make them more digitized so that I can engage with the product as it is functioning. Of course, we all know cars that are trying to become much more customer-centric. And of course, all the devices that we purchase, there's washers, dryers, whatever, refrigerators that are smarter and doing a lot of things that make us actually monitor their use over a period of time while it is in use. So again, all of this is changing dramatically the way products are designed. The digitization is actually adding content to the product. And of course, the service is becoming a significant component of it so that I can know when I should replace a product or replace it with something else or buy complementary products and so on. So basically the summary here is that all of this transformation is driven by a consumer that is driving the needs, and they want to have the ability to look at what's out there. They want to make decisions on what they want to buy and how they want to buy it and how it should be distributed. And they want to be able to eventually engage in the product in an active manner. Even recreational facilities are trying to get me to engage while I'm going to a sports arena, such as plays or museums that actually tell me to take pictures and share with my friends. So there are a lot of things that are happening that are allowing consumer to become much more engaged in everything that they're dealing with. Okay, so that leads to the next story. So what does this have to do with digital leadership? Well, since I teach a course, one of the things that I always encourage students is if businesses are transforming so rapidly, and they're all transformed because consumers are demanding the transformation, then you as a business had to continue to think of innovative ways to define those services. What services consumer is expecting? Are they in the awareness phase or empowerment phase, engagement phase? And then build an agile infrastructure so that I can build it faster, because we know that a consumer demands don't remain static. And of course, you need to have the business dynamically, quickly change. A good friend again of mine at University of Arizona by name late Bob Lush, he and I worked on a paper a long time ago on services and the value services provide to consumers. And if If we look at the transformation that is happening, it is all about service-oriented economy we live in and how everything we do has to kind of fit into that framework. So if I'm going to define services, and of course most of these are digitized, then I need a leadership that allows me to quickly build these services using technology that I can use, either internally or external technology, and of course bring the product to market. McKinsey calls this running at 2 speeds. Fast speed is where I continue to innovate and evaluate and explore, and then a regular speed to keep the business going. Well, running at 2 different speeds in an organization is not that easy. It's almost like my jogging, trying to figure out am I running or am I walking. The bottom line is it requires a little more effort on what is it that I'm doing and how is that fits into my broader organizational strategy. So we went back to research on complexity theory, which basically says that today's organizations, or any complex organization, has to run between instability and stability. They never are stable. They're always moving between these two. And to do that, you need to have 3 different types of leadership. Administrative leadership, obviously, to keep the organization running at 1 speed. Enabling leadership is where you actually explore new ideas. And adaptive leadership is where you then take the ideas that you come up with and then bring them back, especially if they're shown to have a promise, bring them back and make them routine as a part of your business. So you need these 3 to make a complex organization successfully navigate today's market dynamic. By the way, every one of us here is a complex adaptive system. We are human beings, do all these things. We do certain things regularly, we explore new ideas and learn from successes and failures, we adapt as a part of the process. So it's nothing that different, just that it's organizationally it's much more complex to manage these. Which leads me to the next story. As I returned to faculty in 2013, I was trying to figure out what I want to do with the rest of my life. And I came across an executive from a hospital by name Jack Weiner. He runs a hospital not very far from where I live. And he's doing some innovative things. But he doesn't want to say those things to me. He said, why don't you come and take a look at what we're doing? And tell us what we're doing, give your insight, and maybe we can write some papers. Of course, as a faculty member, we always like to write papers, so I said, glad to. So I spent 3 years learning more about what they're doing. And remarkably, it's a small community hospital. It's a very good clinical hospital. But over 7 years, they have transformed themselves to become known as a technology or digital leader in the way they use technology to provide customer services, in this case, patient services. So it's not because I told you that, or it's not he's told me that. It's actually an organization that runs competitions or actually solicits nominations from healthcare organizations every year, about 350 or so. It's a Wired magazine and they actually they have CIOs and CEOs of hospitals evaluate these proposals. And they select 20 as finalists and then eventually 1 as the Innovator of the Year award. So I looked at what they have done. And here, the top 4, actually all 5 of them, were finalists in 3 successive years. And the 5th one, which I'll go a little bit more into detail, won the Innovator of the Year award. So obviously some external individuals looked at these and said they're doing something interesting and it's worth at least finding what it is they're doing that we can learn from. Well, as I mentioned before, a part of agility in building services in organizations that are and innovatively build services quickly, again, all of these are done in about a 6-year period, requires a very flexible architecture in the IT. For those that are technology oriented, they built a very flexible structure that built around their current EMR system, which doesn't change, so that runs at regular speed, but all the various technologies that they adopted kind of work around it with some flexibility so that they could navigate without disrupting and still explore new ideas. And that's an agile structure that seems very appropriate for this type of an environment, where new technologies come into play every year. But what's interesting is the business side of it. They created a team that includes executive officer, medical informatics officer, the CIO, and a business intelligence team, and of course some of the nursing staff, because some of the services are related to the patient. And they all formed a team, and they each one played different roles at different points in time, and some became the administrative leader for some, and then some did the enabling aspect of it to explore technology, and then once it has shown some promise, and then somebody took over and tried to adapt it to run their regular operation. So it's really that governance process and the way they built this culture of leveraging innovation or new technologies to support innovative services is really remarkable. I have not seen that in many organizations. Of course, I don't have access to all of them, but in a hospital, I think that is actually fairly impressive. So I want to actually go into one of those, patient room services, a little bit more in depth, because that kind of drives eventually the point I want to make. Now, patient room services, if you are ever in a hospital, whether you stay for one day or several days, you have many things you are doing in a room. You're communicating with the nurse or attending staff for a variety of reasons. You may fall, so they may be having some hospitals trying to reduce the fall risk because that's extends the length of stay. And of course, they want to make sure if you're diabetic, you don't take food that's without taking the appropriate medication and so on. And I'll elaborate some of those in a minute. But I think they identified all these services that they provide to the patient, and they looked at technologies to support each one of them to try to figure out. And by the way, the total number of technologies they have are about 11 different technologies using 7 different vendors. So it's a very complicated process for an organization that never used an external vendor at all other than their electronic medical record system. Now, remember there are 3 services I mentioned: engagement, awareness, and empowerment. One opportunity hospitals have is to really engage with the patient because they are there for a period of time. Now, obviously, they are there to get the diagnosis and eventually get treated. In the process, many different people play a role. So the question is, as a hospital, do I simply do what is necessary to cure the patient and send him out? Or do I actually use the opportunity of engagement to make really and educate the patient? Because there are opportunities that exist to not just cure, but also make the customer a good, conscious customer that understands what it is that is being done. As a matter of fact, a lot of research shows that it's a time well spent in hospitals to provide good experience where you're not just attending to the service, but also telling them what is expected and what are you doing at each stage. Like, they created this communication mechanism, so I had 3 different people come for pain and bathroom break or general information. Why do I have to have 3? Why can't I have just one person come? Because as a patient, I like to have one person interact with me. Nobody explains why they have 3. It would be useful to say, hey, there are nurses always busy, so there are other things that she could do. Maybe you can actually do, somebody else can do others. So by explaining to them, they understand, oh, I see what you're doing. Same way, I'm taking insulin. Why should I take oral or a pill? When do I take what? Well, it depends on how much time you have before you are ready to eat. If you're very hungry, you may want to take insulin. But if you can wait for a while, maybe you can take a pill. Do I have the option to do that when I go home? And monitoring vital signs. They have a thing that measures 5 different vital signs. Why do I have to have 5 different vital signs monitored? Again, it's done, and I don't care about it, but the point is, I go home. Suppose I'm a chronic care patient, and I have a high blood pressure, and I have temperature. Should I worry about it? Sometimes it's one element is one thing, but if I have a combination, that's disastrous. So shouldn't I be educating the patient on, hey, these are the things that are happening, so you want to watch for. So the point of all of this is, let hospitals try to use the opportunity they have to engage a patient while they're there to actually educate them, make them aware of what is happening. Because that makes me a better consumer of health once I leave the hospital, whether I'm a chronic care patient or a patient that happened to go back and start playing games or doing whatever. I think it is important that we start thinking differently about the care within the hospital so that you use the engagement to support the awareness phase, because that's the first thing I want to know. Now, besides, and I'm not saying they're not doing any of it, but I don't think there's any conscious effort in educating patients in many hospitals. And I think that is one opportunity for transforming, caring for sick, but caring for the healthiness of the patient. Now, we do a lot of projects with hospitals outside, and many of them, of course, are doing it today because you want to reduce readmission costs. So you call high-risk patients. So they follow certain procedures. You provide communications on blood tests and others through portals. And I have a hospital that actually sends physicians and nurses to cardiac patients, visiting them in nursing homes to make sure they're attended to. So and of course, you are using a lot of remote monitoring devices to help track patients from a remote location and make sure they're okay. All of these are there, but again, all of these are centered from a hospital-centric point of view, because hospitals want to reduce the cost. So they want to do these things to make sure you don't come back. But are they empowering the patient to do some of these things on their own? Are they empowering the caregivers that are reporting to do some of these things on their own? Remember, when you are a patient, a hospital looks at you as a patient when you are there. But once you leave the hospital, you go to different states. You could be monitoring your health, as if you're a chronic care patient, constantly, or you could be maintaining your health. You young people that go to hospital for bone fracture or whatever, you go back in your regular life. So, of course, you could be a healthy state, even though I'm not sure anybody is completely healthy. You should always be maintaining health. But also the ecosystem that we go into is different, because patients are the hospital sees a patient in one room. They're all patients. But once they leave, they go into different environment. And the support structure they need and they have is completely different. So the question is, if I'm going to make that patient or person that acted as a patient when they're in the hospital leave the hospital, how can I look at the segment that is actually going to different environments, and what can I do to empower them so they are managing their care effectively? Now, hospitals have a very good opportunity to segment the population, more so than companies spend millions of dollars doing data analytics to segment population. But hospitals know already where you come from, where you're going, what your ailment is. So they have opportunity really to identify the ecosystem you have and how do I best help you manage within that ecosystem. So maybe instead of having you communicate, have the patient talk to you. Because my mother-in-law is 96 and she comes from a hospital home, and I ask her, what's going on? What's your discharge instructions and what's your prescription? She says, I don't know. Well, can she go to a portal and pick it up? Maybe not. She would rather pick up the phone and call, or touch maybe an app and ask for information. So empower the patient to seek information than you providing the information. Create a social support structure that allows patients to interact. Because oftentimes the biggest problem in healthcare is, again, I identified 4 things. Social diagnosis says reaction, role, relationship, and resources are 4 things that define the type of environment you're in and what you need to do to manage it. And my reaction to a disease is much easier to handle if I know there are other people that I could be connecting and talking to. Can a hospital provide me that social support structure? Or can it work with somebody to provide that structure so I can interact? Because we've done some research on health exchanges and patients that went through some cosmetic surgery, and they like to talk to other people that went through so they can engage and interact. Give them tools so that they can actually seek support and improve the role they can play. I think the more they feel that they have a role to play in the process. Even my 96-year-old mother-in-law, I know I'm picking on her, she gets up in the morning and gets on Facebook and knows everything that's going on with every member of her family before we even get up. Now, she could just as well take hey, I can click on something and I can actually find out what my prescriptions are today that I need to take. When do I need to replace them? Give them a role that they can play so that they become more empowered in the process. And look for resources, because one of the things hospitals often don't do, and again, this is a part of alignment, because you have a lot of people out in the network, whether it is nursing homes or whether it is social network where public health workers working with people that are economically challenged that need health care. There is actually a company working with in global to local in Seattle that does a lot of work once patients leave the hospital and go home to provide access to care. The important thing is there are networks of people that you connect with as an individual, but somehow those are never brought into the process that allow me to use the resources I have and the relationships I have to enable me to become better at managing my care. Now, you can say, is it the responsibility of the hospital? Or is it the responsibility of the payer? Is it the responsibility of the government? It's a responsibility eventually has to be collectively. We need to figure out how to make our healthcare system not only treat the sick, but make us become better consumers of health. And that means we need to do everything possible to really empower me as a consumer of health to become good at managing my care so that I don't go end up in a hospital for reasons that I could have prevented. Now, I know there is a lot of discussion today in recent press about all the changes going on in the hospitals. A lot of AI getting into clinical diagnosis, big data analytics telling us which patients are high risk. And of course, there's a lot of hospital mergers and vertical and horizontal trying to make up efficiencies. These are all things typically that happen whenever there is a market dynamic and you're trying to maximize your profit and minimize your costs. Now, I'm not against that, and that's a part of hospitals being profitable. By the way, there is no hospital that is nonprofit. They're all profitable hospitals. Now, profit hospitals, they have to do something charitable so that they can claim the deduction and say they are nonprofit. But why not use some of that charitable component to provide these educational and empowerment activities in partnership so that you can actually become a hospital that, maybe I'm picking broadly as hospital, could be any care facility, broadly speaking, to allow the population to become healthy consumers. Now, are there tools available today? I think there is a lot of entrepreneurs coming into picture, portals, wearable technologies, and everybody wants to Fitbit and tell me exactly how many steps I take. But why can't that Fitbit communicate with my portal that tells me, my physician, that I'm actually walking? I had to go and tell him that I am walking. He's not sure that I'm walking. So, there are ways to connect some of these devices so some of the information that is happening can be communicated to them and back to me. There is social media. Why not? I know a lot of young people get on the exercise machine and start interacting with others virtually as if they are in Utah or somewhere ski slopes and they're exercising and they want to share what they're doing with their friends. And today there are technologies available for you to do a lot of social media while you're exercising. Well, that there is a lot of interest in today in technology that can empower younger people to do some of these things, but yet some of those are not actively integrated into the system that allows patient the care that hospitals may are providing. Of course, there are a lot of new intermediaries coming to actually help me reduce time it takes for me to get a patient appointment, for a physician appointment, or get some blood tests done. There are concierge providers that provide. So there are a lot more of these things going to come into picture that are going to provide competition for hospitals or care. And as a consumer, I want to look for these things. Going back to my story about a guy, a forum I went to this December, one of the guys said, Mohan, where can I go to like a price line so I can find my knee replacement? You know, it's becoming such a commodity today to get a knee replacement. Why can't I go and shop around and find best place I can get knee replacement? So I think as more and more of these things come in, they're intended really to provide more opportunity, but also they need to be brought in a broader healthcare scheme. Of course, you know, the picture on the right is kind of complicated. So of course we all like 2x2s. So I put a 2x2 here just for the for researchers. But basically what I'm saying is there are two, is a person that leaves the hospital either goes into a supportive ecosystem, or sometimes they have limited support from an ecosystem because they don't have family or they live by themselves or whatever. Some people are in a health monitoring state, some people are in a maintenance state. Depending on where you are, where a patient is, there are ways that you can leverage the external care providers or social network that a person may have or can use to empower them and to care for their own with a little more confidence, I guess, rather than rely always on my physician or the hospital to cure me if any problem comes in. And I kind of put four different, because on the left corner, of course, are all the young people that want to do a lot of things. Why not give them the tools in the left top corner? I can't see if I'm coming there. But anyway, and that's where they are. They want to be aware, they want to be empowered, and there is technology they can use to do that. And of course, the right is where older, active, engaged customers. We live in a retirement community in Arizona. And of course, there are people that are professionals from companies that just happen to be 65 and decide, or 55, decide to retire early. They're hikers, bikers, tennis players. They all want to be engaged in their own health. Yes, they may have a physician they want to interact with. They want to be engaged. So the point really is, again, how do you leverage these resources and the people's interest in managing care and transform the way we provide that support? Well, the summary of it all is digital leadership in healthcare is like any digital leadership, any business. We want hospitals to look for innovative services to care for me as my patient. Continue to create a culture of innovation within a hospital so they can do those things. But I think it is also important, if we need to really transform the healthcare system, that we need to have the hospitals and the payers and others to start partnering with external care providers, family members, and other social network that I'm part of, to start allowing me the opportunity to know more about what I need to do and empower me with the tools that are necessary so I can manage my care. So the engagement is what hospitals do, which is the top part. Empowerment awareness is what I want healthcare systems to do if we are to really transform us, become good consumers of health rather than simply patients that go to hospital when you get sick. So to me, that is the essence of population management, not just managing population that happen to be sick and they belong to your hospital, but it's really managing population so that they become better consumers of health. With that, I am open for any questions.